All right, well, I just finished a couple of virtual consults today. I'm in my empty office, and I thought I would share with you some of my favorite skincare products because some of my patients have reached out to me and said, oh no, my skin is so dry. What do I do? And I can't get my Botox and I can't come in and see you. And I'm like, I know. So my skin is oily. T-zone is really bad. I still get pimples here and there, even though I'm 48, turning 49. So my preferences would vary compared to some of you, but I'm going to share with you what I use for my oily skin in order during the day. So my favorite cleanser is LHA. It's by SkinCeuticals. It's designed for oily skin. It is not abrasive to your skin, and it is gentle enough to use at least twice a day. And it has a nice tingly feeling, so it's really good. Also, what I like about it is I can put it right over top of my eyes. It doesn't sting your eyes because I often get soap in my eyes. Then, after I am finished cleansing in the morning, I will use my Phloretin CF Gel. This is also a SkinCeuticals product. It is an antioxidant, and it's really important after you cleanse to use an antioxidant because during the day and with time we get lots of free radical damage to our skin. UV rays, sun, wind, and just time, and the cells can change. There's DNA injury, and so an antioxidant will help your skin cells, especially the bottom layers of your skin, to regenerate and help them to fight some of those free radical damages. After that, I usually wear MAC Cosmetics foundation, which kind of acts as for UVA and UVB protection, but my favorite sunblock is also SkinCeuticals. It is called Physical Fusion. I like it because it's SPF 50. It contains titanium and zinc, which are known as physical sunblocks, as opposed to a chemical sunblock like PABA. Now, titanium and zinc are white, and so there's a little bit of pigment in here, and even my husband uses this, believe it or not, every single day. He has sort of a ruddy complexion just from years of sun damage, and even some of our darker skin patients really like this Physical Fusion because you put it on, it's very thin, it goes on almost like water, and you can use it face, neck, chest, ears, back of your neck if you're going to be going out running. And the titanium and zinc, just remember at the end of the day, say you're going out and you're going to be taking pictures, a flash of a camera will reflect off it and you will look pasty white like a ghost. And I have several pictures of me at conferences where I'm posing for pictures and I look white like a ghost, and I forgot because I'm still wearing my Physical Fusion. So note to self, if you are going out at night, maybe take off your makeup and reapply it without the titanium and zinc. After that layer, my favorite sunblock powder is from Color Science. It's an SPF 50. I use medium pigment, and I love it because it will go on top of your makeup. You can reapply it during the day. It has powder in here. I hyperpigment. Here's an oven burn that I got on Thanksgiving when my sister Ingrid was visiting. And you don't want either your scars after surgery or a pimple to hyperpigment like that. So this is amazing because there's a brush. It goes on like makeup, and you can put it on during the day. The Horton twins actually really like this. It doesn't hurt. They can apply it themselves. And I personally hate shine. I'm always putting on powder during the day. But this is great, and I think everyone should have one of these in your car, in your purse, in your house, in your bathroom. Say if you have a pool like me, every time you go in to use the bathroom, just reapply some face, neck, chest. And it is an amazing product. So I love this one. Then, at the end of the day, as long as I'm not too tired and I fall asleep with my makeup on, which happens sometimes, after I use my cleanser again, this is a new product by Skin Better. It is an alpha retinol makeup remover pad, and it also will apply retinol to your skin. It is exfoliating. It is amazing to help you get through a stressful time like now when we're all in shelter in place. And this is a great product to use. There are 30 pads in here, and I don't use this every day, but it is amazing. A product that I do like to use at night is also by Skin Better, and it is their Alpha Ret Cream. Now, RET stands for retinol, and retinol is one of the chemicals which has been proven in scientific literature, it's on all the plastic surgery journals, to help promote skin regeneration, improve the appearance of your skin, reduce the appearance of fine lines, to hydrate. If you are using a retinol cream, it can be really irritating to your skin, and so several companies have formulated a retinol product in something like this Alpha Ret Night Cream where it is less irritating to the skin, and their studies have shown that it can be almost as effective, or in some cases equally as effective, to the retinol cream that you would get by prescription either from your dermatologist or from Emily Suspaniak in my office. I tend to alternate that Alpha Ret Cream with this product by Replenix. This is a 5X cream, and again, I've mentioned I hate shiny face. This is actually a really nice cream because at the end of the day, you know, I don't go to bed immediately after I wash my face. It has sort of a matte finish, and so it will cover up shiny face. I really like it, but I think my skin is a little bit used to it. There's a 2.5X. This is 5X, so I'm thinking I'm actually might go up to the 10X. I have used this a couple years ago. My skin wasn't ready for it yet. You kind of have to build up tolerance to it, and I found that my skin was really itchy afterwards and it was peeling. But I think I'm ready for the Replenix 10X, so I'm going to give this a try. I'll get back to you. It's the Retinol Forte. Lastly, eye cream. I've really only started using an eye cream because as I reach nearly the age of 50, crinkles, and so my favorite eye cream is the Lumiere cream. This is the Extra Riche it's by Neocutis, and I like it because it's not too greasy, it's really light, it goes on really nicely, and so this is my second last step of the day. It sounds like all I do all day is put on skincare. That's not true. This would be like a really good day. But my last product that I do try to use every single night is Latisse. Now, I love Latisse because it's based in science. This was actually a glaucoma medication that it was discovered in patients who had glaucoma. When they put the drops in their eye, it grew their eyelashes longer. And amazing scientists went, aha! Just like Botox was also used for an ophthalmic use. They first injected Botox around the eye in cases of blepharospasm, where patients had spasm of their eye muscles, they couldn't open their eye. They noticed that in the surrounding areas they had less wrinkles, so that's how Botox was invented. But Latisse is amazing because Latisse will grow your eyelashes longer and thicker. My eyelashes are blonde. I don't leave the house without mascara, so it doesn't make them darker. But if you naturally have dark eyelashes, it will make them darker. Now, I'm blonde hair, blue eyes, and I was very concerned about the report that it can change your eye color. So I want to explain what I learned from our Latisse rep several years ago, whose father was an ophthalmologist and who could explain things to me in scientific terms, because I practice no BS medicine. If I don't understand how it works, I don't believe it, and I also need to know what's the potential risks and complications. So how it was explained to me is that yes, it's a glaucoma medication. We don't put the drops in our eyes. There's a little dropper. You put a little bit on the brush, and you can use one drop for both eyes. The company won't tell you to do that, but that's what I do. Of course, you don't want to do that if you have an eye infection on one side. You don't want to transmit it to the other, but they give you way too many brushes than you need. So you can actually stretch a 1 month supply out for at least 2 months, maybe 3 if you don't use it every night. You are only putting that little drop on your lash line, and you should do it right before you go to sleep. If you do get a little bit in your eye, you can just blot it dry. But for the patients who are using it in their eyes, meaning the glaucoma patients, what they found is that only 0.2% of those patients, if they had green or hazel eyes, just like it can stimulate more melanin production, which is the pigment in your eyelashes, in 0.2% of patients, which is less than 1%, it could cause a green or hazel eye to have a little brown spot. But for people like me, who have blue eyes, I don't have any melanin in my eyes. So my chance of having my eye turn color is essentially 0 because I don't have any melanin in it. But I still make sure that I don't put it in my eyes, and if I do get a little drop, then I'll just blot it dry. So, to review, I'm going to turn the camera. Here are all my products from morning until night. Oops, doing it the wrong way. We have my SkinCeuticals, my antioxidant, my sunblock powder, my Alpha Rep products, my 5X, 10X, my Lumiere, and my Latisse. And now that I have so much time on my hands, because I'm not seeing a ton of patients, you can expect my skin to be even more glowing and hopefully looking fabulous. Hope that was helpful. I would be very happy to answer any questions. In our office, Emily Suspaniak, who's our aesthetic nurse practitioner, she is the Bay Area Injector on Instagram. She's the expert. I might not be able to answer all of your questions. I will definitely pass you on to Emily. And hope this was helpful. Thanks. I'm happy to share.